Right. So 30 years ago, 40 years ago, when scientists were talking about climate change, we used to look at it from a very specific, scientific, and almost academic lens. We did not understand how it was impacting our lives directly as much. But those many number of years later, today, when we're sitting in 2023, there is consensus among scientists, among policymakers, among world leaders, and among the general public that climate change is real, climate change is here, and that climate change is impacting our everyday lives. And a big facet of that everyday life is, of course, good health, which makes up the largest part of good quality of life. So today, what I'm going to be doing is I obviously have an hour, and then we have to keep time for questions as well. So this will be more overarching, and we'll talk about the ways in which climate change intersects with health and the challenges that it presents. And then I will talk a little bit about solutions, but I also want to hear about you guys because you're the experts and in terms of how you see the solutions approach and what the bottom line is. So Azara, if we could move to the next slide. So those are some very jarring numbers, but before I get into what they mean, climate change across the globe is impacting hundreds of millions of people. And it's impacting them in a lot of ways. We obviously have your understandable and well connected to climate change, which is climate related disaster. So you've got your hurricanes and your heat waves and your wildfires and your droughts and your flooding. And it is agreed upon by scientists that they are most likely intensified due to a warming atmosphere. And what that does is when there is devastation of that scale in any part of the globe, it has a direct impact on health. So according to the World Health Organization, by the year 2030, there will be more than 250,000 additional deaths that can be directly attributed to climate change. This is in addition to the deaths and the number of death tolls that we're experiencing currently. And the monetary impact that it will have on healthcare systems worldwide is $2 to $4 billion by the year 2030. So those are some very big and very scary numbers, especially in the context of Pakistan or any other developing country, because one, our vulnerabilities are exacerbated when climate change is concerned, and two, we do not have the money, the financial or the technical resources to deal with these kinds of challenges. And what climate change does is that already existing vulnerabilities जो होती हैं वो उनको exacerbate कर देता है. So we'll talk about that in the next slide, Zara, if we could move forward. So how does climate change affect physical and mental health? Because we talk about this in arbitrary terms a lot, कि climate change जो है वो हमारी daily lives impact कर रहा है. But the how is always a question because it's very difficult to put a number or a statistic on it. But after the number of years of research that we've had on this particular subject, there are some things that we can say with absolute certainty. And a number that I keep coming back to, जो कि मुझे बहुत ज़्यादा surprise करता है हमेशा in my research, is that according to the Lancet, they conduct very thorough research. More than 5 million deaths every year annually are attributed to either abnormally hot or abnormally cold temperatures. And that is alarming because as we've all experienced the heat waves last year and the year before that, and we're all seeing, at least this March, this was a surprisingly cold March, but mostly we've had hotter springs and more springless years than ever before. So extreme heat is something that all of us actually experience in our daily lives. It's not a far off impact of climate change. And so to have 5 million people die every year because of hotter or colder temperatures is very alarming. And then you've got the World Health Organization saying that there will be additional deaths because we do not have the capacity to engage with or adapt to these changing, atmospheric circumstances. Then how is your physical health affected? So climate change दो तरह से काम करता है. One is जब climate related disasters होते हैं, जैसे कि हमने देखा पिछले साल, which were the floods. So you've got your immediate impacts, which is that when the water comes down and the houses come tumbling down, there is death and there is injury. So those are immediate impacts. And they require medical attention, of course, and they require relief and aid work. But then you have got your subsequent challenges, which are related to health as well, which is child and maternal care. And that's very befitting for today's topic as well, in light of International Nurses Day and Midwives, because maternal health, maternal child health, and access to sanitation, access to sanitary products, that is something that is one very understudied in our part of the world. And that is something that impacts women the greatest when a disaster strikes. And that is something that sort of, other than the work that is done by, say, aid organizations or organizations like AKU on a policy level, that is not something that is looked at as much. And the third thing that happens is that in the aftermath, or in the subsequent days and weeks and months, with stagnant waters, you've got waterborne diseases, you've got skin diseases, and you have got a weakened healthcare system that does not have the capacity to deal with them. So those are some aspects of physical health that are impacted by climate change. And then physical health is not the only thing that's impacted. You've got mental health as well. And mental health is a very understudied, but a very important aspect of how climate change impacts our daily lives. And so what happens is that because of climate disasters, I think about 20 million people worldwide since the year 2008 have been forced to move or displace because of some weather-related event. So 20 million people have had to leave their homes, uproot themselves from their communities, from their houses, from what is comfortable to them, and move to unknown territory. And many of them have had to do it in the circumstances where they've either lost their loved ones, their homes, their livelihoods. And so the mental health impact of that and trauma of that, I'm sure you've studied this as well, you're all healthcare professionals, is that one, there's your immediate trauma, and one, then there's generational trauma. And something like this impacts people for years and decades and generations to come. And so that is a very long-term consequence of climate change that we're experiencing. And according to research, the number of displaced people is actually going to increase every year. So you've got millions of people within countries moving away from their homes, but you've also got external displacement as well. So it works in two ways. For instance, when the floods occurred, people were obviously moving to urban centers because unke jo ghar the wo doob chuke the, there was nowhere for them to stay and there was no shelter. But then you've also got international climate displacement, which is something that we see in the Americas quite often, is that you've got people moving away from small island nations because their entire countries are under threat of, going under the sea, and sort of, rising sea levels threaten them a lot. So what they do is that they take their entire families and they move away. And that is a kind of trauma of leaving home, of being displaced from your community and your people, that is actually directly associated with climate change, but is one of the most understudied impacts of it. And then you've got research that says anxiety and depressive disorders get worsened, particularly in young people. And that is, even if you don't speak about it in scientific terms, or if we don't speak about it in like really academic terms, it's a very understandable thing. अगर आप सोचें इस बारे में कि आप एक young इंसान हैं जिसकी जिंदगी, again we go back to the floods because they're so fresh in our memory and they're also so close to home, was impacted by climate change. Now your education has been impacted, your family's livelihood has been lost, and if you were already in a vulnerable position, you're more vulnerable. But even if you weren't, your vulnerabilities have now increased. There's an uncertainty about your future. And so the toll that puts on young people, particularly because those are the ones who, it's generally understood that have many more years to live on this planet, they're the ones that are most deeply impacted by this. So climate change very directly, जब हम सोचते हैं उसके बारे में तो हमें ये लगता है कि oh, you know, you've got your hurricanes and your droughts and your food security issues, which are all there, which are all very, very important and need to be studied. But they're the immediate impacts. They're the immediate impacts when somebody loses a life, when somebody becomes injured due to a climate-related disaster. But the long-term impacts, the ones that sustain that disaster, the one that sort of live to see the day and then talk about it, and the generations that live to see the day, they are dealing with both physical and mental health impacts that our healthcare infrastructure does not have the capacity to deal with. And when I say our healthcare infrastructure, I do mean the global healthcare infrastructure, but most certainly the Pakistani healthcare infrastructure, because those are not things, mental health is not something that we anyway understand completely as a society. So its linkages with climate change are even less understood within the field and most certainly outside of the field as well. And I believe that Khan's been doing some really good work even up north, where a lot of people have been experiencing climate-related mental health issues because of, you know, melting glaciers and losing their homes. But we're not doing it to scale. And that is something that I personally think, in my capacity as a journalist, the healthcare industry really needs to start thinking about. Zara, if we could move to the next slide. So vulnerability factors. The way that climate change works is कि जो भी आपकी society की existing inequalities होती हैं, climate change related issues उसको बस amplify कर देते हैं या उसको highlight कर देते हैं. So if we look at the case of Pakistan, we would see that somebody living in rural parts of the country who's less privileged, has less access to technical and financial resources, is already at a disadvantage. Geographically speaking, if you live closer to the coast, especially in cities like Karachi or in Thatta, your vulnerabilities are exacerbated because you're dealing with sea level rise. Then you've got your biological factors and your existing health status. So, for instance, if you already have, say, diseases, you're immunocompromised, or you've got like disease passed on through genetics, you're in a vulnerable position. Then comes the difference between socio-political and socio-economic conditions. So that brings in issues of race, of ethnicity, of which caste, which creed gets more priority in a society. And these are all existing issues. These are all issues that already are woven within the fabric of our society. What happens when a climate-related disaster strikes is that vulnerability increases. So जो already उस position में हैं, they're becoming more vulnerable. और वो उस position में इसलिए हैं because they already have not had the ability to get themselves out of there. I don't know if that point is coming across as thoroughly as I would like it to, but I try to explain it further a little bit. Again, with the example of the floods, and excuse me for going back to it again and again, but when we saw that devastation so close, I looked at it very closely and spoke to communities. So I'm looking at it from a very personal perspective as well. Let's start with demographic factors. In the province of Sindh, for instance. Now, if you're somebody who's living very close to the riverbed and the riverbed is flooding, or if you're somebody who's a low-income farmer who works on like a landowner's or a feudal lord's farm, you are economically disadvantaged from that, right? If you are a young girl, you are already vulnerable because one, you're not considered an equal in society. Your education is not considered important enough. And you are the most dispensable person or dispensable member of a family. When disaster strikes, what's going to happen is that your family, and this is backed by research, especially in developing countries, what they want to do is they want to reduce their vulnerability. So जब आपके साथ कोई vulnerable लोग होते हैं, सबसे पहले आप उनको dispense करना चाहते हैं. So the probability of child marriages increases. because people want to do away with that element so that they can deal with the rest of the family. And then you've got your socio-political conditions, of course. So, right, if you're in a certain feudal system, somebody has power versus somebody who doesn't, who's powerless. So we saw in the case of in the floods as well, is that the direction of the water, it was redirected to people's homes because they had that power. So the vulnerabilities all increase. And now we think about the fact that, oh, your healthcare system ko kaise impact karta hai. But then if you really go and dig deep, you realize that it does actually impact the healthcare system. And let's take the, child marriages example, for instance. If you've got young girls getting married, there's obviously a lot of concern towards abuse. But there's also concern about pregnancies in teenagers, in young girls, pregnancies in women who are already in, say, stagnated waters, who don't have access to good maternal health care. And so that is a direct consequence of climate change that impacts healthcare. And that's not something that we think about when we think about it immediately, because that it's a long-term consequence. It's not going to happen immediately. There was a lot of conversation, I remember, that there's more than 700,000 women who have to give birth in stagnated waters. But I wonder how much research has been done into how many women were married off, how many girls were married off, how many more complicated teen pregnancies are we going to see that they're not going to have access to healthcare for. So vulnerability factors are compounded and they work in multiple ways. And that is something that both needs to be looked at from the healthcare system's perspective and a policy perspective on a provincial and a national level as well. Because right now, we don't have anything that addresses these long-term consequences. Abhi tak hum sirf disaster management or immediate relief ke baare mein sochte hain. But the next thing that we need to think about is how we're going to empower our healthcare system enough to deal with these larger consequences of climate change. Zara, if we could move to the next slide. So exposure pathways, and I'm sure most of you know about these, so we'll sort of try to be quick with these. But these are the most notable exposure pathways that are directly related to health. Extreme weather events, which could be anything ranging from floods, droughts, hurricanes, you've got your glacial melts, anything that is compounded or caused by climate change or global warming. So you've got more precipitation in your air, you've got unprecedented rainfall, all of these things. But heat, which I mentioned earlier on. And I remember that I was in Jaiprabad last year, and the heat wave was sort of at its peak. And it was so bad. I remember being at that hospital, and every day in Jaiprabad at their civil hospital, they would have people coming in who just could not bear the heat anymore. And this wasn't just, when you think about exposure to extreme heat or extreme temperatures, you think that the already weakened ones are going to be impacted by it the most. So you're thinking, oh, older people or very young children or women, but it's not that. It's also very young men, very young, very fit men who work in construction, who are used to working in very rigorous environments, who absolutely cannot, whose bodies cannot bear that heat anymore. So what climate change is doing essentially is that these extreme weather events and these heat stresses, what they're doing is that they're not just impacting your already vulnerable, but a section of your society or a section of your population that's considered healthy, that is considered to be the workforce, they're being impacted. And so what that does is that directly impacts your ability to make money. And that is where compounded vulnerabilities come in. So अगर आप एक construction worker हैं और आप daily wage पे काम करते हैं, there's a lot of heat and you're unable to work during that day or for a couple of days, you're losing out on that money. And that's very important money to you because, again, you're making it on a daily basis, you're a daily wage worker. So then it impacts your quality of life. It impacts the resources that you're able to provide for your family. So heat stress or extreme weather related healthcare issues are not immediate. They completely impact families and they impact socioeconomic positions of families. Then you've got air quality. Now, air quality is very interesting because air quality is not technically a climate change related issue. It's actually a very controllable problem that Pakistan still has not been able to deal with. But air quality, and please correct me if I'm wrong or feel free to add on to this, but air quality directly relates to your respiratory issues and your health issues. And that is something that you can control on a policy level, both provincial and national level, which is just by having more robust standards for your vehicles so that they're not emitting, PM2 particles out in the atmosphere. But even that is something that we're not doing right now. So sometimes climate change it's very global, it's very large scale. It comes in the form of floods that nobody could be prepared for. But then you've also got your issues like air quality, which are lowest hanging fruit. And that is where the real test of both not just the healthcare system, but the policymakers also comes into question. Because it is with the low hanging fruit that you start addressing these problems and then you go on to the bigger ones. Because the bigger ones, the last two, food and water quality and food security, this is where it's at. This is essentially what it comes down to. Because what climate change then does is that it goes on to become a security issue, and a very serious one at that, both internally within nations and then externally between nations as well. And so your water and food quality, whatever you're consuming, this is as basic as it gets, as whatever the quality of whatever you're consuming is what your health is going to be like. And what happens is when you've got climate related events which are already impacting your crops. I think this was a good year for Pakistan, particularly because we got rain and we had a good amount of wheat crop. But last year wasn't so much because first we had the heat wave and then we had the floods. So we lost a large percentage of our crop. The same happened with India. And so when that ends up happening, you've obviously got your issues naturally of malnutrition, but you've also got issues of like there being threat to life, because what life eventually comes down to, which is the natural principle of the universe, is that you have to be able to feed yourself. And so when your resources are limited, the conflict is going to arise. And so what then that happens, again, this comes back to compounded issues of climate change on healthcare systems and on people's lives, is that one thing leads to the other, leads to the other. So your immediate impact is that people are losing their lives because something like a flood happens, and people have lost their homes and people have been injured. And another compounded impact is that you've got, young women or pregnant women who are now being forced to give birth in stagnant floodwaters. You've got women who don't have access to sanitation. Then you've got young girls who are not being sent to school and, who are being married off. And so the possibility of them dealing with healthcare problems at early age arises. And then after all of those immediate healthcare problems are being addressed, you're now looking at the fact that, our crops have been damaged. We don't have enough food to feed this entire country of 200 plus million people. What do we do now? And then that causes food security problems, that causes malnutrition problems. And again, malnutrition problems, this is widely studied and agreed upon by scientists as well, that जब आपके resources कम होते हैं, तभी भी आपकी already vulnerable populations all vulnerable हो जाती हैं. So, and I keep bringing back women and girls into this because there's such a big piece of this puzzle, and there's such an ignored piece of this puzzle as well. Is that they're the first one, again, the most vulnerable and the most dispensable. So least access to resources and least access to good, healthy food and nutrition. It always goes to the boys, whether you're in rural or urban centers, according to research, because they're the ones that are sort of considered the most important members of the family. And so what you're creating is not just healthcare issues, but also exacerbating existing inequalities in society. Zara, if we could move to the next slide. Okay, so this is essentially something that we've discussed already, that these are all climate-related health risks. And most of these you would know: injury and mortality. We talked about heat-related illnesses, respiratory illnesses due to air quality issues particularly. But let's talk a little bit about the other problems as well. And we saw this. Now, there's nothing to say that COVID-19 was a climate change related healthcare issue at all. We do not have substantial research for that. But what we do have substantial research for is that the more we experience climate related extreme weather events, the chances of pandemics and endemics increases. And you're all healthcare professionals, so I believe you would understand this perhaps even more so, and maybe make me understand this as well. But it's, to the human mind, it's a very simple connection, right? When there are changes in your atmosphere, when there are changes in biodiversity, when biodiversity is threatened, when your ecosystems are threatened, and when your species are threatened, what ends up happening is that you've got a lot of new diseases coming out that you, one, have not been studied, and two, you do not have the capacity to deal with. And even if it was not a climate change related pandemic, what it did highlight was that our healthcare infrastructure, and by our, I mean the global healthcare infrastructure, is incapable of handling something of that scale. And what scientists are saying is that something like that has been woven into the atmospheric fabric. So every few years, you're going to see some version or some form of disease that you've never heard of before that is going to spread very, very quickly. And we do not, one, we've not studied it, but two, we do not have the capacity. And so Pakistan, again, becomes even more vulnerable in a situation like this, because your healthcare system is already weakened. It already does not, by any means, especially if you're looking at your public healthcare system, which is what we look at when we research, does not meet international standards. And then again, you've got your diseases like, I'm so sorry, I keep seeing messages that people are unable to hear. I'm hoping that most of you are able to hear me.
Zoha, don't worry. There is one or two people who are not able to hear, but we are also recording this session so they can hear recording as well.
Perfect. Okay, great. If we could move to the next slide. And we're at 3:40, which is what I had thought, which is when I would stop talking and we could turn this into a conversation. So very quickly, resilience. But before that, I want to talk a little bit about the effect on healthcare systems, and this is related to resilience as well. So what happens is that healthcare systems that are already weakened, they are going to be further impacted. And how they're going to be impacted works in multiple tiers. The first one is obviously cost, which is what I spoke about in the first slide as well, that we're experiencing damages up to $2 to $4 billion every year. And those are all kinds of damages, right? But what happened is that in 2012, I was researching about this, and I read that in more than 10 climate events in 2012, the US itself experienced more than $10 billion of health-related costs, because there were so many number of climate-related events in that year, and there was so much burden on the healthcare system that it caused them more than $10 billion. And now, if we just think about those numbers in terms of Pakistan, those are huge numbers, right? Those are numbers that we don't have. This is not just healthcare, but largely the floods have caused more than $30 billion of damages in Pakistan, and they will cost about $300 billion in recovery. This is according to the World Bank. And we're currently in an economic position where we're looking for relief from the IMF for less than $2 billion. So the disparity in those numbers is huge. And the health-related costs in our country, they have not even been studied for us to be able to say कि हम actually कितना ज़्यादा economic impact face कर रहे हैं because of climate change-related disasters. So I think it would be very okay for all of us to go ahead and imagine the absolute worst when it comes to how our healthcare system is impacted if $10 billion is something that it costs the US. because the scale of the floods that we experienced was unimaginable, it was unheard of, and it was a once in a century sort of situation. And then equity, of course, climate change does not impact people equally. So low income people, of course, in the global north, that is people of color, but in Pakistan or in the global south societies, that would be your indigenous communities, your farm workers, your daily wage workers, your domestic help. So everyone who's in already a vulnerable position. Then also you've got, and this is important, is people who are already working in hazardous occupations. So first responders, they are the ones really at the front lines. So they're being impacted by climate change as well, because the threats that they face on a daily basis in their jobs, they're amplified. Somebody who's a first responder, they may not necessarily, have the training or have the means to be able to combat something to the effects of the floods or the hurricanes or the droughts that we're experiencing in this world. So their vulnerabilities are exacerbated, and that includes your entire healthcare and your health force, which is something that we saw during COVID-19 as well. And then you've got people living in already weak and environmentally fragile surroundings. And this is very important in the context of, say, Sindh, where you've got a lot of coal power plants, and you've got a lot of pollution and a lot of contamination in the water within those communities that are already indigenous. So they're not only facing the consequences of this because they're indigenous, but also because they're living in these very fragile environmental situations. And these are parts of the country that do not have access to good healthcare. So if you're in an emergency situation, if in a respiratory emergency situation, you do not have access, your closest healthcare system or your healthcare facility could be as far as 10 kilometers away. And so that obviously exceeds the vulnerability. And then you've got your people with disabilities, which again are not studied in a Pakistani context. And I think that's really important. And that's something that we need to keep coming back to again and again. In my capacity as a journalist, one of my biggest challenges always has been that I can never find numbers, data, and statistics related to Pakistan particularly, or even South Asia for that matter, but especially Pakistan. So we don't go into deep dives as to how people are being impacted. We rely on international research. We rely on research of the global north. But their situation and our situations are completely different. And so the very big gap, the very big reason as to why we're unable to address so many of our climate change related healthcare issues are also because we don't know enough. We don't know how many people are vulnerable, in what capacity. We don't have enough information. People with disability, for instance, or people who are homeless already. There's so many people who experience homelessness in our part of the world as well. Where do they come into data and research? That is something that we don't have. And then, in addition to all of that, is access and quality. So not only do they not have immediate access, they also don't have access to good quality healthcare systems. And what that is doing is that what we've not studied yet is that a large part of our population is rural, a large part of our population is socioeconomically disadvantaged. And at some point, when that entire population starts becoming impacted, it's no more just a healthcare issue, it's an economic issue. And the sad part is that usually जब कोई भी चीज economic issue बनती है तभी वो policy level पे address होती है. The problem with that is that it's too late by then. Your disease has spread, your workforce has reduced, you've lost people have lost their lives and their livelihoods. So how do you address all of this? That's where resilience and sort of, bottom line comes in. Is that first of all, you need leadership. So we need somebody to look up to, somebody who is taking initiative in these fields and who is really, and I always look at leadership from a data point of view. Leadership and governance for me is always, if you don't know the problem, if you can't measure it, you can't address it. And so one of the biggest responsibilities of leadership and governance first is to conduct enough research for policymakers and for healthcare practitioners to be able to say that these are the issues that we need to address. And then we need better information systems. So I think that's where the role of journalists come in, whereby you need to, I see someone raising their hand.
First you finish, and then I would request, please write your questions in the chat box. Thank you.
I will just take 5 more or even less than 5 minutes, and then we'll dive into questions, I promise. So information systems is where journalists come in. This is very important because if we do not, right now, for instance, we're having this conversation among people jo already thoda bahut at least samajhte hain, you know, including myself and you all, obviously, you're all practitioners, you see this in your everyday lives as well. But when it comes to the general public, there's a big gap. And that big gap can be filled both again by first responders who are out in the field. I always think of, you know, our very, very brave polio workers who've done so much for this country, you know, like they've really been on the front lines, even though if not, that's not a climate change related issue, but they've really been at the forefront of addressing this problem and really communicating. And so the media needs to step in alongside them, alongside first responders, alongside healthcare professionals, and really make it the center of conversation, which is not something that happens in Pakistan. We are not talking about the impacts of climate change so many months after the floods. We were talking about it when it happened, and we were talking about it when we were seeing those devastating videos, but not anymore. And the problem with that is that climate change is not just, it's not a one-off problem. It's not a one-off issue. It's still ongoing, but our information systems are not delivering that level of information to the general public. And then you need financing in both medical technologies and healthcare workforce. So you need more people in the healthcare profession, that is for sure. Those are the people that are really going to help us address this, but also the people who have their, you know, finger on the pulse and they understand the problem. And 2, we need medical technologies, which is something that we don't invest in. Excuse me. We don't invest in, and again, that is because of our economic status as well. So building resilience is a multi-tiered sort of, or a multi-layered approach where you've got leadership and governance in policy and data. You've got information systems where both your first responders and your, you know, media practitioners come in. You've got financing, which has to come obviously from the state level, but also from the international community. Because one of the biggest problems with climate change is that the countries that have caused it are not so much at the front lines of the impact as the countries who have had the least hand in emitting as many greenhouse gases into the atmosphere. Pakistan, for instance, we emit less than 1%. We are one of the 10 most vulnerable countries to climate change impact. So that financing also has to come from outside of our country. It has to come from the international community. And alongside that financing also has to come technical and resource help. So that means how they're dealing with their problems. There has to be information sharing. There has to be regional cooperation. Bangladesh they're excellent in disaster management when it comes to floods. So there has to be some sort of, communication between communities and countries, and they have to put their geopolitics aside to be able to address it. And the healthcare workforce sort of, it has to be at the forefront of it. We could talk a lot more about the bottom line, displaced people and injured, but I really wanted to leave some time for questions. We're already at 3:50 p.m. So please, if you have any questions, any comments, anything at all, I hope this was of some value. I'd like to hear from all of you now.
Zoha, thank you. This was such an excellent presentation. First, let me tell you, almost 150 audience are there. Although when you look participants, it's 47 or between 50. However, in one room, there are about 50 people are sitting, and in another room, there's 6, 7, or 10 together. So this is the way they are attending, and our numbers are saying it's about 150 nurses and midwives that are listening to you. And this was a very, very, very good session. Zehra, let me know if there is question in the chat box. Meanwhile, this was such an important eye-opening session that we nurses needs to raise first awareness among ourselves. Two of my students are right now studying and doing their thesis on climate, especially climate in the cold weather and food security, as well as cold winter, and in the what kind of healthcare providers are dealing women and newborn in the maternity settings. So we are slowly moving, but I think it's high time for us that we have to develop some kind of modules and courses to make our own health professional, number one, awareness, number two, intervention, how to take it to population and public, and third thing, what kind of be it indigenous and our own research generated scientific interventions and outcomes for the population, which are our own. So these are very, very important talks. May I request Yasmin Parpio in the chat, whatever questions you're seeing, please ask Zoha. Thank you.
Thank you, Dr. Rafat. So the first question is, LMICs face the climate change as a double sword. With weak infrastructure and healthcare system, we are affected the most. Secondly, we have limited finances to address such catastrophe. In addition, the priorities are so different that it's hard to allocate resources for such disasters when the acute current problem are many. Can you share a few examples where low resource settings have efficiently responded to these, and which models have been reported as a success story?
Thank you for that question. And a very important one that is actually something that we talk about all the time, is that low and middle income countries, really, they are at the front lines of this. But what I touched upon briefly, I think is great. Bangladesh is an example. I always use them. And we studied them deeply as well when the floods were happening. And I was talking to experts who work in disaster management, is that floods are a part of the natural fabric of Bangladesh's sort of, weather patterns. They happen every year and they're really, really bad. But since the 70s, the death toll has been absolutely minuscule. So despite the fact that every year they experience these devastating floods, they have a robust enough disaster management system and a response system that is so well connected, both on the state and a local level and onto the federal level, that they've been able to minimize what is essentially loss of life is something that we think about. That's the first thing that we think about addressing. And they've been able to do that successfully. And they're a country in our region. We don't have to look, further away into any other part of the world. They're right there, almost practically next door. And what we saw in Pakistan, that was one of the biggest problems when we experienced the flooding here this year, was that we did not have cooperation. We did not know who was working in which area, what parts of the country were accessible, what weren't accessible, what the people needed. So I think one example of a country that's managed to do somewhat of a great job and is actually a very, very vocal participant in the climate change conversations is Bangladesh. And I think we have a lot to look at and learn from them.
Thank you, Zoha. So there was another question regarding the relationship of climate change on mental health problems. So again, one of the participants is just asking if you could just share any model or any example where countries have worked on mental health issues and which was happening due to climate change.
So I'm going to be very honest with you. That's not something that I've come across at least in my research. I'm sure it exists somewhere in some part of the world. I'm assuming that some welfare state in the European Union has started looking at it, very deliberately. I haven't come across it so much in South Asia, but I was recently watching a documentary about how people in Pakistan up north have, started experiencing mental health problems to a scale, and what local practitioners over there are doing to address it. And I think one of the things that needs to happen, and this is a very rudimentary answer, it's not academic or it's an expert answer at all, but I think it's one that I believe in fundamentally, is that where Pakistan needs to start at, actually, we don't even need other models. First, what we need is sensitization towards mental health issues, because our baseline is weak when it comes to that. We don't even consider it an important enough issue as is. So its intersection with climate change is a very far off thing for us. So I don't know whether that's a successful model or not, but the baseline where Pakistan needs to start, I think, is by sensitizing mental health and really putting it at the forefront and equating it as much as, physical health is important, so is mental.
I agree with you. We give less attention to mental health. I was wondering, I read a lot about Nightingale notes and Nightingale life. She was in Crimea War, where all this climate issues, sanitation, what she suffered, which we didn't realize until I studied a lot about her. She gone through after Crimea War when she returned back to her home, because in a way she was displaced to come and help those who were injured. But throughout her life, she suffered with post-traumatic syndrome. And it was so severe that she couldn't, then come up with such an active life what she had. So we don't know, especially our vulnerable population, elders or women who are giving birth or who are going through pregnancy, young girls. We don't know what kind of trauma there is. This only displacement, any other kind of violence within when they are displaced, what they are suffering, and what kind of, like, I really learn one word from you, that generational trauma. So we don't know that the post-trauma has been passed in any generational traumas. I think this is a very, very important aspect to know. I think usually when we conduct these sessions, we try to really finish on time. It was so good. I don't want to finish. Yeah. There is one last question. Yes, Yasmin, please go ahead.
I can read from.
Yeah.
Okay, so this person is writing that recently I visited to Sangar, which is one of the most affected area. From the feedback of government stakeholders, the major issue that they face is the workforce and huge communication gap. How we can address these problems?
Thank you so much for that question. I will just add something to what Dr. Rafat was saying. And it only just occurred to me when you talked about Nightingale, is that we look at trauma and stress and anxieties and mental health from an affectee's point of view a lot, but you also make an excellent point about the mental health of the people who are responding to these problems. So it's two-tier. You also have to look at the workforce, your healthcare professionals who are dealing with this day in and day out, the mental health impacts that it may have on them. And so that has to be an aspect of study as well. That has to be an aspect in the policy making too, because the people who are addressing as first responders are also being impacted mentally, physically. It's a very demanding profession to be in. So that's just something that I wanted to add. I thought it was an excellent point you made. As far as communication gaps are concerned, I think I touched on that just a little bit, is that's where the media comes in, truly. That is where I will put the responsibility and the onus on my profession entirely. And as I did say, that the problem in Pakistan is the fact that we have selective memories and we sort of move on from things very quickly. When the news cycle finishes, we don't look at follow-up stories or, consequently what has happened. I was talking to a colleague and she was telling me she was visiting Sindh I believe she was going to Larkana, and on her way, she saw that there were a lot of places that still had stagnant waters. And the floods occurred in August 2022. It's been that many months. I've not seen it in any other news agency. I've not seen anyone cover it. I've not seen conversations about the long-term impact. So, of course, how can we, in our individual capacities, address it is that we have more conversations about climate change. But systemically, I believe that that responsibility then really falls on the media to make it a central conversation. And that means that they really have to prioritize it, because it's not something that gets a lot of audience numbers and it doesn't get a lot of TRPs. But that is what the need of the hour is. So even when COP27 nahi ho raha hai, or even when the floods aren't happening, the media still needs to talk about climate change. So I think there I would put the responsibility entirely on the media and the communication channels to take this.
Thank you, Zoya. Zahra, can you type outreach email address? I'm sure all of participants have still many questions. They will send it to this email address and we can ask you, Zoya, in future. Last 1 minute, participants who are together in rooms or they are joining together, just write their total number in the chat box. We are so happy that so many people are attending together. So there are student, faculty member, nurses. We are extremely happy. We are so grateful to Zoya Tunio, who has given us time. She agreed as a young journalist, और इतना ज्यादा insight उसने climate, workforce, healthcare issues पे दिया है, it's a mind-boggling. और हम सबको मिलकर सोचना है कि it's a high time कि अब हमें जो current studies करनी है हमारे अपनी areas की जो devastation है, like floods, heat, extreme cold weather, and all the diseases which are born from stagnant water or seasonal. These are so important for us. We have to really pay attention, and especially socioeconomic condition. और ये सारी चीजें हैं, and like Zoya said कि climate इसको और ज्यादा aggravate करता है. So we nurses, how can we bring one thing which is comfort? How can we bring comfort and pain relieving, whether it is mental or physical? I'm extremely grateful. Thank you so much, Zoya. Inshallah, who knows, we are going to invite you again. Thank you so much. Khuda Hafiz.
Thank you for having me. Khuda Hafiz,
Khuda
everyone.
Hafiz.